Alright, let's see if we're going here. Yeah, it looks like we're up with a little bit of a delay. Hello, and welcome to another live stream. Thank you for being here. This week we're just answering your questions. We're talking about some things about the different types of bleeding, what to do when your patients don't get better, what do you say to them, how do you approach that, some Zongfu stuff, and some other stuff. So if you're here live in the chat, go ahead and say hello. Let me know where you're watching from. If you're watching on the replay, go ahead and leave a comment and let me know where you're watching from. Let me go ahead and minimize this over here, because that's going to distract me. Yeah, just before here in the chat, we were talking about we're going to get a blizzard this weekend in Colorado. I had to go out and buy a snow shovel just in case I get snowed in. So, yeah, Dongtan is here. Yeah, I used to be on the West Coast. He's saying, yeah, I used to be in San Diego. I moved to Colorado, and so now I'm going to have some fun with the snow. They said it's going to be really wet snow, so it's going to be good for building a snowman. And so I'm excited to see how much it snows. I got some snowshoes. I'm going to go out and build a snowman. I got some carrots. Are we going to get more Drunken Podcast with Patrick? Actually, yes. I just talked to him this week because actually what I wanted to do is I wanted to do a podcast with his wife. That's Patrick and his wife Karen run their clinic together. And so I got Patrick on. I wanted to get his wife on and ask his wife some questions. So we set that up. And so hopefully we'll be able to do another session with Patrick. So yes, that was the most drunken episode of the podcast so far. There was actually like 4 hours of audio that I couldn't use, but we just kept drinking and talking, and a lot of it was stuff that shouldn't be public. I totally threw up after that podcast. So that was the most drunken one, but yeah, people said it was a lot of fun. So yeah, hopefully we'll have him on again and then maybe do some other stuff. It's been hard scheduling some people, and I've been trying to get some other people on, but apparently a lot of other people are trying to be real healthy and they don't drink and stuff like that. So we'll see if that happens. All right, we got Dung is from Virginia, and we got some people from Baton Rouge, so that's awesome. We got some people from all over the place. It's a lot of snow. Yeah, I forgot to stock up on hot cocoa. I meant to get that, so. Anyway, I don't really have a topic to talk about. I just have some questions. I just pulled some questions. I saw some interesting stuff on Facebook, on a couple of Facebook groups. I had a couple emails, and so we can just dive into that with some questions. If you're here live and you have a question, you can ask a question in the chat. Sometimes it's easier if you type question in all caps, or if you put 4 question marks at the beginning. That's a little bit easier to see in the chat box because I squint a lot when I try to read. But let's just get started. Fluffy's here from Croatia. Hi. So what do we have? This is something I got on Instagram. What's the difference between bleeding due to excess and bleeding due to deficiency? And so this is something I have trouble with explaining the causes of bleeding, because this is something that in Bensky, he says there are 3 causes of bleeding. When I learned from my Chinese teacher, he said there are 4 causes of bleeding. When you look in Nigel Weissman's Materia Medica, the Weissman and Brand Concise Materia Medica, he says there are a few main types, but he lists out we can expand into 6 or 7 different types of bleeding. So it's kind of gets hard to explain about how we should present this, because they're really all saying the same thing, but it's a little bit difficult about how to organize those thoughts. So just to be clear, here when we're talking about bleeding, we're talking about the internal causes of bleeding. And this is a little bit different from bleeding due to injury and trauma. If I fell and scraped my knee, that would be bleeding due to injury and trauma. If somebody came up and stabbed me in the back, that would be bleeding due to injury and trauma. And we have certain herbs that we can use externally Things like Yunnan Baiyao, main ingredient in that is san qi, so we can apply herbs topically to stop bleeding. Even if someone had like a surgery, that could be like internal bleeding, but we would still consider that injury and trauma, and we might even be able to take Yunnan Baiyao internally. But here what we're talking about is the internal causes of bleeding. And so instead of bleeding due to injury trauma, this would be things like nosebleed, coughing up blood, vomiting blood, blood in the urine, blood in the stool. And I think the one we're probably more common to see in clinic is excessive uterine bleeding or excessive bleeding during menses. So we could have heavy bleeding, that the volume of blood is a lot. We could have prolonged bleeding. Period is only supposed to last 5 to 7 days. If it goes beyond that 5 to 7 days, we could call that prolonged bleeding. Or we could have spotting between periods, metrorrhagia, that if we have some bleeding that happens between the normal cycles. So that's kind of what we're talking about when we're talking about the causes of bleeding and the internal causes of bleeding. So like we said, we're talking about what causes this bleeding to occur, things like nosebleed, vomiting blood, blood in the urine, like Lynn syndrome, UTI, excessive menstruation. What are the causes of this? And like I said, if we go to Bensky, he lists 3 causes. Let's see if we can do this on the fly. Switch to there, switch to there. Oh, don't do that. This is gonna work. There we go. So according to Bensky, he says there are 3 causes of bleeding. We have stagnation, heat, and he says deficiency. So these are our causes of internal bleeding. So how do these work? When we say stagnation, basically what we're referring to here is there's blood stagnates in the channels, in the vessels, and so the blood has to go outside of the vessel to go around the point of stagnation. So this is a little bit weird because usually we think of like how can stagnation cause bleeding? Well, it's really there's a point of stagnation and then the blood has to go around it and ends up going outside of the vessels in order to go around the stagnation. And when blood goes outside of the vessels, that's bleeding. When we say heat, remember that heat causes things to speed up. So if we have heat in the body, that speeds things up. It speeds up the blood. It speeds up the blood so much that it causes the blood to move recklessly or frenetically outside of the vessels. And so that's bleeding due to heat. Basically, it speeds things up, and the blood gets so fast and moves around so chaotically that it's no longer contained within the vessels. It moves outside of the vessels, and we get bleeding. Deficiency is the one where we get weird. So, like an easy way to explain this would be, remember in fundamentals class, at the very beginning, we talked about the different functions of qi. We said qi has a function of warming, it has a function of transformation, it has a function of defense and protecting the body from exterior pathogens. Well, one of the functions of qi was containment. That would be containing the qi in, so we don't have loss of qi through cough. That could be containing the fluids in, so we don't have frequent urination. That could be containing essence. But one of those functions of qi containment is that qi has to contain the blood inside the vessels. And this is something we specifically associate with spleen qi. So if spleen qi is deficient, it fails in its function of holding the blood in the vessels, and so the blood goes outside the vessels, and that's how we have bleeding. So the problem here becomes, really when we say deficiency, we can mean 2 things. We can mean either qi deficiency, or we can mean deficiency cold. And so this is kind of a thing. When we just look in Bensky, he says these are the 3 causes. We have stagnation, we have heat, and we have deficiency. But something we should pay attention to when we're looking at the herbs is, we actually don't have any herbs that treat bleeding due to qi deficiency. Like in that category, we have certain herbs that invigorate blood to stop bleeding. We have herbs that clear heat and cool the blood to stop bleeding. We don't really have any herbs that tonify qi to stop bleeding. For that, we have to go to the category herbs that tonify qi, and we can use formulas like gui pi tong, restore the spleen decoction. Normally, when we talk about gui pi tong, that's for spleen qi deficiency with heart blood deficiency causing Shen problems, but it's actually also indicated for bleeding due to the spleen not controlling the blood due to spleen qi deficiency. But so what we have to be careful about is when Bensky is talking in that category about deficiency, what he really means is deficiency cold. And so that would be spleen yang deficiency, giving us deficiency cold, and then the blood flows outside of the vessels. And so we don't have any herbs that tonify qi to stop bleeding, but we do have herbs that warm the channels to stop bleeding. So herbs like aye warm the channels to stop bleeding for bleeding due to cold, but that's bleeding due to deficiency cold. So I guess this is where it gets weird, and I'm not quite sure how to like differentiate these two. It gets a little bit weird. So that's why when I was in school, the way we did it is we said there are 4 causes of bleeding. We have blood stagnation or blood stasis can cause bleeding because the blood is going outside the vessels to go around the stagnation. We have bleeding due to heat. The heat causes things to speed up, and so the blood moves recklessly outside of the vessels. We have qi deficiency. When spleen qi is deficient, it can't contain the blood in the vessels, and so it moves outside. And then we have cold. So here, I like to list cold as a separate one, because here we're saying deficiency cold causes bleeding, and that's why we have certain herbs that warm the channels to stop bleeding. Things like aye, things like paojiang, and a few other herbs. So I'm not sure if that really made much sense in terms of, but those are the causes of bleeding. And then it turns out if we go look at Nigel Weissman, he'll actually break it down a little bit further. So he can say there are 6 or 7 causes of bleeding. But here he's just kind of breaking these things down that when you talk about stagnation, we could have just plain stagnation, or we could have, we just have plain blood stasis, or we could have stagnation due to cold. If I can spell stagnation right. With heat, we can have excess heat or deficiency heat. That is heat due to yin deficiency. That heat will speed up the blood and cause it to move outside the vessel. So we could have an excess condition, like when we get a febrile disease, and when the external heat gets into the blood level, we get rashes, maculopapular rashes, bleeding out of various orifices. That could be an excess cause of heat. Or we could have heat due to yin deficiency. That can also speed up the blood. We can have bleeding due to qi deficiency. And again, this was spleen qi deficiency. And there we'd have to go to our qi tonics. And when we have cold, basically cold can be then put into 2 different categories. We can say cold causes stagnation, or we can say cold causes deficiency, as in spleen yang deficiency. So I feel like that explanation just made everything so much more confusing. But when we get back to the original question, what's the difference between bleeding due to excess and bleeding due to deficiency? Basically, we have these different causes of bleeding. Excess causes is we could have excess heat speeding up the blood and causing the blood to move outside of the vessels. Stagnation would also be considered an excess cause when you have blood stagnation or blood stasis. The blood has to move around that area of stagnation and it moves outside of the vessels. When we say bleeding due to deficiency, we usually mean either qi deficiency, the qi is failing to contain the blood, or we have deficiency cold, which really means spleen yang deficiency. And again, the spleen is failing to contain the blood inside the vessels. And so that's something we're going to want to pay attention to especially when we prescribe our herbs and do our treatment, is that we can have it both ways. So we have some herbs that clear heat and cool the blood to stop bleeding. We have some herbs that invigorate the blood to stop bleeding. And we have some herbs, just a few, that warm the channels and they treat bleeding due to deficiency cold. So this could also come up in with acupuncture. So think about our point. We have a very good point for stopping bleeding. Spleen 1 stops bleeding. And we can actually use this for bleeding either due to deficiency or due to excess. So if we have bleeding due to excess, due to an excess heat, what we can do with spleen 1 is we can prick to bleed. Prick to bleed will release that excess. Prick to bleed will release that heat. And so we can drain heat from the body and stop the bleeding, especially if we have bleeding in the upper body. If we have like bloodshot eyes or nosebleed or coughing up blood or bleeding in the upper body, that's usually due to heat. We can prick to bleed spleen 1. That will clear the excess and it will take care of bleeding due to excess. However, if we have bleeding due to deficiency, especially bleeding due to deficiency cold, this could be like women with spotting between periods or women with heavy menses or prolonged menses. We want to stop the bleeding because they're losing too much blood and we worry about they're going to become blood deficient if they keep bleeding so much. Well, then we can still use spleen 1, but now our technique is to use moxa on spleen 1 because moxa is IA. It's one of those herbs that warms the channels to stop bleeding. So we do moxa on spleen 1 and that will warm the channels to stop bleeding and it will be bleeding due to deficiency. So those are different treatment strategies for bleeding due to excess and bleeding due to deficiency. And that's one of those things that we need to differentiate. And I suppose this gets back to our like 8 principle diagnosis where you always talk about 8 principles. We're basically asking very general questions about, is it hot or is it cold? Is it internal or is it external? Is it deficiency or is it excess? Is it yin or is it yang? So that's something we need, even if a person presents with a bleeding condition, we might want to ask, is it excess or is it deficient? Is it hot or is it cold? And that's going to kind of direct our treatment. And kind of a random aside here that sometimes I like to bring up when we talk about bleeding is sometimes people have this idea of if you're doing acupuncture on a patient and say you just do normal acupuncture and when you remove the needle, the point starts bleeding, some people will say, oh, that's a good thing. That means your body has heat. And so the reason the point is bleeding is because you have heat and that's a good thing that we're releasing that heat. I'm pretty sure that's not a real thing. This is one of those things like I've heard a lot of people try to say this. I've never actually seen this in a book or anything. But I'm pretty sure that people are getting confused here. What we're getting confused about is, on the one hand, yes, heat can cause bleeding. That if I have too much heat in the body, that blood will move frenetically outside the vessels and cause bleeding. So heat is a cause of bleeding. And then, like we said, prick to bleed is a treatment method for clearing heat. So if a person has a lot of heat in their body, they have a really red face, they have high blood pressure, they're sweating a lot, maybe they have like strep throat and they have this really burning throat with heat toxicity causing pus in their throat, then we can bleed the patient to release heat. We can prick to bleed the Jing-Well points, we can prick to bleed ear apex to lower the blood pressure. So pricking to bleed is a strategy for clearing heat. However, that doesn't necessarily mean that every time the patient bleeds, that means they have heat and you're clearing heat. I mean, it would be like if I fell and scraped my knee, I wouldn't be like, oh, my knee is bleeding because I have interior heat. So it was a really good thing that I scraped my knee because now my body's releasing that heat. We're like, no, that's not what happened. I'm bleeding due to injury and trauma. If somebody comes up behind me and stabs me in the back and I start spurting blood, you wouldn't say like, oh, that's a good thing. He has heat. Where that bleeding is releasing the heat. It's like, no, the reason I'm bleeding is because you shoved a sharp metal object into my body. And so the same thing happens with needling, that if you needle spleen 6 and it starts to bleed, that doesn't mean the patient has heat. That means you put a sharp metal object in their body and you hit a blood vessel and now they're bleeding. So that's kind of a rant, but it's kind of one of these things where it's like, if you want to say that to a patient, if you like needle Li4 and it starts bleeding, if you want to say that to a patient, be like, oh yeah, that means your body has heat and this is just a way of releasing the heat. And so that's a good thing. It's a good thing that you're bleeding. You can say that if you think it'll comfort the patient. I don't think it's true. I think you're just making something up in order to make the patient feel better. Really, what happened is you stabbed a blood vessel, you stabbed a capillary or something like that, and basically you caused injury and trauma, and that's what's causing the bleeding. It's not a serious thing, but it's not indicative of heat in the body. So that's just kind of a rant. Veronica, I hope you're smiling at my rant. Oh, hypothetical question. For trauma B syndrome, are distal points to clear the channel or alleviate pain worth worrying about? For example, trauma to the TMJ. So this is interesting. I guess we're talking about two different things here. Are we talking about injury trauma or are we talking about B syndrome? Because sometimes we have to differentiate them. When we say sometimes they go together, but usually when we say injury trauma, like I got punched in the TMJ and I broke my jaw, usually we're diagnosing chi and blood stagnation. When we say B syndrome, we're talking about an external attack of environmental wind, cold, damp. That wind, cold, damp is coming into the channels and obstructing the free flow of chi and causing pain. So so sometimes we need to differentiate those. But then again, sometimes they go together. Like sometimes, like I had a friend that she broke her toe doing yoga, and I would say initially that would be injury and trauma. That I think she was trying to do a handstand, and her spotter didn't spot her, and she fell on her toe. Anyway, I think acutely that would be like injury and trauma. So we would treat chi and blood stagnation. However, even years later, after it heals, now when the weather gets cold, she can feel an ache where that bone broke, and so then I think now we could call that, oh, that's more like B syndrome, that the environmental factors of cold are causing pain. So now we would consider it more like B syndrome. What was our original question? But if we had injury and trauma, is it worth it to worry about? Yeah, generally, I think it's good to do both local points and distal points. So if we have injury and trauma, we're usually diagnosing chi and blood stagnation. We can still use distal points to move chi and blood. We could do local stuff. If we had like TMJ, we could do local stuff into the jaw. We could, if it's like a real injury with swelling, we could surround the dragon. We could apply liniments, but we could also do distal points. We could do Li4 because it's really good for moving chi and blood. It's also the command point of the face, so we're like doing distal things. So I think still activating the channel, it's still a good thing. I'm kind of like, needles are cheap, do both. So yeah, I would still do both. And if it's really acute, it could be that doing some like liniments and stuff might actually be more helpful, depending on what the situation is. And then, especially if you're into Hungar, maybe check out the book "A Tooth from the Tiger's Mouth," and this was about. It's kind of more about like sports injury type stuff, and it was from that tradition of the Shaolin monks and the people who did kung fu. They train a lot and they would injure themselves during training, and so they had their own system of liniments, dit de jiaos, die jiajiu, zhenggu shui, and they had all these liniments to help them heal from injuries. And so that book gets into a lot of that kind of stuff about cupping, when it might be a good idea to do bleeding cupping in order to relieve stagnation, what kind of liniments and external things we can use, what kind of moxa we can do in order to move chi and blood. But then we can also talk about doing local points in the area as well as doing certain distal points. And sometimes just general points to move chi and blood can be helpful, like four gates, Li4, stuff on the gallbladder channel just to move that. Because again, we just want to move chi and blood. Surround the dragon. So this is just basically, it's like if you have some area that's affected, you put needles all around it, and that local needling will draw chi and blood to the area. Usually when we're doing that, it's there's something going on that we don't want to needle directly into the area. So sometimes it's like, oh, my anterior delta is really sore. I'm gonna needle jian qian jian nei ling. I'm gonna needle right into that sore spot to release that muscle. But if, say, I got bit by a stingray and now I have this huge lump on my hand or foot, I don't necessarily want to put a needle right into that abscess or right into that sore. So instead what we can do is we can stick needles around it. Usually we just, however many needles you want to do, you can go around it, and you usually needle the angles in towards the thing that's affected. And that's just a way of it's kind of like needling sure points. You're not really needling a channel, you're not needling a specific point, you're just sticking needles in the area in order to stimulate an immune response, in order to draw chi and blood into the area so that it can clean it up. So that's just, people just say surround the dragon, instead of saying, oh, I did 4 points around here, we just say, oh, surround the dragon, and that's just the name of that technique. Yeah, and I think it's called Tooth from the Tiger's Mouth. Maybe I'll put a link in the description below after this if I can find it. But yeah, it's kind of a cool book that goes over again, injury and trauma, sports medicine, things like that. What is your opinion on Chinese face reading? What is your opinion on Chinese face reading? Do you practice? How much validity is there to it? This is maybe difficult. Because this is one of those things, when we say face reading, we can talk about a couple different things. Sometimes if you're just reading Machiocha and doing regular TCM theory, we'll talk about different things like the shape of the face, whether you have a round face or a square face or a triangular shaped face. Sometimes we'll talk about different areas correspond to different things. Basically, we take the 5 elements and stick them on the face. When we do that, when we take the 5 elements, we're using the version where earth is in the middle, fire is on top, water is on bottom, and then liver and lung are on each side, or wood and metal are on each side. And then we get into a debate, is wood on the left or is it on the right? And we say it's on the left. Is it on my left or is it on the patient's left? Anyway, there are certain things we can do like that. Then I feel like there are other things that are more like, you have a line right here and that means your mother didn't love you as a child, or you have wrinkles in this area and that means you went through some hardships in your 20s. I don't know a whole lot about that, and it's one of those things where I've seen those presentations at like Pacific Symposium. There's one person who always does stuff with facial readings and facial diagnosis. I've gone to a few of those lectures and I've always been confused about it, because it never really seemed to fit in with TCM. Because when I look at diagnostic factors, I'm trying to think of, how do we put this in terms of a pattern diagnosis? How do we put this in terms of a channel diagnosis? And when I've seen some of those people do face readings, it seems more like of an astrology thing and less of it's like, if you have something right here, if you have a green patch right here, maybe that means you have a liver thing. Or if you see some yellowish color right here, that might mean dampness in the spleen. Usually they're saying more like, oh, you have a line right here, that means you have unresolved anger from your childhood. I'm like, I don't know how that helps me in treatment. So I don't know if that answers the question. So sometimes I do look at the face. If we're talking like a Japanese style diagnosis, they'll look at the sense organs. So if a person has a really big mouth, that might mean they're a spleen constitution. If a person has really big eyes, that might mean they're a liver constitution. If a person has misshapen ears, that might mean they're a water constitution. So sometimes that's interesting to look at. Sometimes we can, if you're doing like J.R. Worsley 5 element or just regular TCM, we can look at the color of the complexion. If a person has a yellowish complexion, that means they're they have an earth CF. If a person has a reddish complexion, that might mean they have heat or they have a fire constitution. So I might look at those things, but in terms of like wrinkles in this area, I don't do that. I usually look at other diagnostic factors. I look at acid questions, take the pulse, look at the tongue, and I kind of do that. Do TCM physicians use stethoscopes? As far as I know, no. Only if we're looking in like when we're doing our modern diagnostic factors to rule out red flags. So you might see a TCM doctor use a stethoscope when they're taking blood pressure, if they're using a sphygmomanometer instead of the electronic one. So they might use a stethoscope there. We might use stethoscopes to rule out certain red flags. So if maybe we'll want to listen for bowel sounds to make sure there's no bowel obstructions, things like that. We can do basic things like that. But in terms of traditional diagnostics, I don't know that's part of our diagnostic system. I've never seen that used in a classical sense. So really we're doing more things like we're palpating, we're taking the pulse, we're palpating the channels, we're looking at the tongue, looking at the face and the complexion, and we're using those for diagnostic methods. As far as I know, stethoscope is more of a modern thing that we just mostly use to rule out red flags, and if we do see those, we would refer to a Western doctor. Any tips for point selection and treatment style? So I wanted to get someone on the podcast, a friend from school that she went through school and she did the whole TCM thing. I'm not sure if she did Japanese style stuff in school or not, but then after school she took some seminars on master tongue points. She went to the J.R. Worsley 5-element school, and it seems like she's done all these different styles. So I kind of wanted to ask her about what she thinks about all these different styles and how does she incorporate them into her practice. Because I feel like usually in terms of those treatment styles, basically it's usually people find one thing that they like that works well for them, and then they're more likely to practice that style. So some people, they went and got acupuncture and TCM stuff didn't work for them, but then they got a Japanese style treatment. They're like, oh, I love this. This worked really well. And so they went into Japanese style acupuncture. Some people, their first experience with acupuncture was with a 5-element practitioner, and they're like, oh, that really spoke to them. And so now when they went to school, they wanted to learn 5-element acupuncture. And same thing with treatment modalities, that some people, it's like they really like getting moxa. Moxa works really well for them. They're more likely to do moxa on their patients. Some people really like gua sha. They had some injury and gua sha really helped them. Now they're more likely to do gua sha on their patients. Same thing with ear seeds. I'm not really into ear seeds. I was thinking I kind of want to push earseeds.com because they have a good affiliate program. So if you want to go to the website and get some ear seeds through that. I actually don't use a whole lot of ear seeds, but some people are really into them. And people who like ear seeds are more likely to use it on their patients. So I think it's like we have a lot of different options, and it's kind of like what works for you. Sometimes with styles, I make this comparison to martial arts. So like we have 36th chamber of Hung Gar. Hung Gar is a specific type of Chinese Kung Fu. Hung Gar was practiced in, correct me if I'm wrong, but I believe Hung Gar was practiced in southern China, where the ground is really soft, the ground is very uneven. I think it was even kind of near the water along the coast with the ports. So a lot of times people would be fighting on ships where the ground is really uneven. So Hung Gar is characterized by very wide, very low stances because they want stability on that uneven ground or even on a rocking boat. Hung Gar doesn't use a lot of kicks. If you kick at all, you're usually just kicking the knee. You're not going to kick someone in the face with Hung Gar because on uneven ground, you're going to fall over. Whereas something like Taekwondo was practiced more in Korea up in the north, where the ground is more flat, the ground is more solid. That's more of a kicking art. So they would kick people in the face. Their horse stance is really high up, and they'll do high kicks and things like that because that's what works for them in their environment. And so it's not to say that Hung Gar is better than Taekwondo or anything like that. It's just that Different things work in different situations. Different styles are suited to different people. If you're really tall and you have long legs, it might make sense that you want to do a kicking art. Whereas if you're more stocky and don't have long legs, then it might make sense that you want to do more of a punching art. So it's kind of suited to that. So I think we can do the same thing with different styles of acupuncture. There are no superior styles of acupuncture. There are only superior acupuncturists. And sometimes it depends on the practitioner, what works best for them. Sometimes it depends on the situation, what kind of things that you're treating. If you're treating a lot of really big athletes, a lot of times they don't like Japanese style acupuncture. It's like these CrossFit people. They really like big, deep needling. They like orthopedic style. They want to feel beat up afterwards. If you come in with your like little red sarins and stick them in 1 millimeter, they'll be like, this isn't really doing anything. Whereas there are other people who respond really well, other situations. So, I don't remember what your original question was. Going back to the stethoscopes, is that taught in TCM school? Yeah, at least. When I went to school, this was in America, and I think this is true of American schools, but I went specifically in California. We did have one class called physical exam where we learned some basics of how to use a stethoscope. We learned some basics of how to take blood pressure and some basics taking the vitals and auscultating for bowel sounds. We might have even listened to the heart to get the S1 and S2 and things like that. So we do learn it a little bit. But I think that using a stethoscope it's like, to do it well, it's an art. And so you have these old school physicians that they can get a lot of information just by listening, but that's something you need years of experience in order to do it. We had like 1 semester where it's like, oh, here's how you take blood pressure. So yeah, and then going back to styles, build a foundation, and then fill it in with other things. So, and yeah, I think this is true of martial arts, where it's like if you do 6 months of karate and 6 months of Shaolin and then 6 months of Taekwondo and 6 months of Jiu-Jitsu, it's basically like you learn the stretches for each one. It's good to have a solid foundation in one and then start kind of branching off and kind of filling in the gaps. So it's maybe that if you do Taekwondo, you get really good at kicking sorts of things, but Taekwondo doesn't really have a lot of grappling work. So maybe after you've been doing Taekwondo for a while, you do some Jiu-Jitsu in order to get some grappling work in. And so I think we can do the same thing with TCM styles. I think that's a good point. Or maybe a story that one of my teachers told me, that he was a 5-element teacher. He practiced back in the day with J.R. Worsley, the founder of that 5-element school. And he would say he would sometimes try to do herbs, and one of his teachers came up to him and said, "Hey, don't dabble. If you want to do herbs, if you want to prescribe herbs, you really need to learn herbs. Go apprentice with an herbal master for 5 years, and then practice herbs. But if you don't want to do that, don't dabble. Don't try to give a formula here and there just to see how it works. You're not going to get good results. You might even injure your patients, so don't dabble. Pick one thing and do it." And he decided, I don't really like herbs. I'm going to do acupuncture. So he specialized in 5-element acupuncture, and that's what he does. And if a patient needs herbs, he refers them to an herbalist, somebody who really knows what they're doing. Yeah, just to know, to find red flags, using a stethoscope to find red flags. And I was really glad sorry, I'm clicking the wrong buttons here. This was actually really helpful, that when I was supervising in clinic, I had one student who, he was an MD and had been an MD for like 20 years, and now he was just starting to study acupuncture to do something else. And so it was really good to have him in the clinic so that we could do those things with red flags. So if somebody come in, he really knew how to auscultate for vowel sounds and things like that. So if ever I had any questions about possible red flags, I'd always go to him. He was really good with finding that out. He also had really good bedside manner. He was really good at explaining things to patients that he could communicate them like directly but firmly, but still in a nice way. I kind of miss him. Apprenticeship, I'm not entirely sure how that works in the US. I feel like technically there's a way to do it that you can get your license through an apprenticeship. I'm not sure, and I'm not entirely sure how it works in the US or how you'd go about doing it. I think what a lot of people do is in the West, they would go through a regular 4-year school, and then maybe after they graduate, they have a mentor that they work with or intern with that they might do it during school and afterwards. So I'm not entirely sure how that works. Whereas I think there was like a traditional way in China that it's like you could apprentice under a Shanghanlu master, and instead of just going to school, going to university and reading books, you would get like years of hands-on experience. But I'm not sure how that works in America. I would have to look into that. Just looking for anything else. Dr. Steven saying, enjoyed your videos. I'm glad you enjoy them. I'm glad people appreciate them. Oh, good. Like the, yeah, yeah. Oh, good. I shave it every once in a while, but I really need to get a haircut. This is like I moved. I haven't gotten a haircut in 4 months. And that's like I moved to Denver or I moved to Colorado, and I'm not sure if haircuts are even legal here. I'm not sure what's going on there. So I was finally like, I'm going to call this week and schedule an appointment for a haircut. And then I watched the news, and apparently we're getting like 15 to 20 inches of snow this weekend. I was like, I don't really want to go get a haircut in the middle of a blizzard. So one of these days, before I start making more videos, I'm going to get my hair cut so I actually look okay in my videos. Speaking of people liking the videos, let's just say thank you to the Patreon people. I always like to give shout outs to the Patreon people that uh, it's people who support the channel through the Patreon. That's what makes this stuff possible. I'm trying to go more full time with making this content, and in order to do that, it's like I still have to pay my rent. So it's nice that we have Patreon people. So some new people this week, Maria. So usually when people join the Patreon, I make them these silly little certificates just saying they're awesome. Maria joined this week. Laura joined this week. Elizabeth. Balvinder. Ali, thanks Ali for joining the Patreon. Jeffrey Rosales, I know him from San Diego. Thank you for joining the Patreon. Elizabeth, I think she's a practitioner. She told me where she's from. I can't remember, for joining the Patreon. So we had a few people joining the Patreon. So if you really like this channel, if you like the videos, you want to support it, that's a way to do it. That's one way to do it, is to join the Patreon. When you do that, this is something I've just been playing around with. Not you. So I started making this community page. It's a company called Circle, but basically you can see it looks kind of like a Facebook sort of thing, except there are no ads and they're not going to steal your data. Basically, I paid them $40 a month to host this, so they're not going to steal your data or sell anything. And so if you join the Patreon, you'll get access to this. And this is just another way to ask questions. It's if you're studying and something comes up, people like to ask about what does Acap mean. I need to put that in the videos. Or things about like empty heat, where would you put Dananxing in the category. So sometimes this is just people are studying, they have a question, you can go there and post it, and I can answer it right away. Sometimes if I have a bunch of them, I'll make short little videos. And so that's one of the benefits of joining the Patreon. So if you want more of that kind of stuff. And then sometimes I post things. I'll post things as I create them. Usually before I upload something to the channel, I make sure it's finished and complete and then upload it. But sometimes I add works in progress to either this or the Patreon feed. So if you're interested in that. And that's a way you can support the website. You can also buy t-shirts. This is the way. All right, where were we going? Oh, does Acap really just mean it's a local point? No, not necessarily. It means it's treating things along the channel. So sometimes when you say like Acap, it might be a point on the hand. Maybe I should make sure you can actually see what I'm gesturing to. When you say Acap, it might be a point on the hand, but we say, oh, this point treats issues in the shoulder or in the elbow and shoulder. And so that just means we're treating things along the channel. By needling this point, it clears out the entire channel, so we're treating disorders along the channel. It doesn't necessarily mean local to the point, but it means the pathway of the channel. That could also be the elbow, the shoulder, the neck, the face, and so things like that. You might need that beard for the snow. Yeah, I'm not always. Yeah. So this was the kind of. So I used to live in Illinois. I did my undergrad in Illinois. I grew up in Michigan, but I did my undergrad in Illinois. And I remember this funny thing happened where like we got a lot of snow, and I was like walking to class, and somebody's like, "Oh, it's a good thing you have that beard. It keeps your face warm." But actually, what was happening is the snow would hit my beard. It would melt, and then it would freeze. So I just had this frozen ice on my face. I think it just it made it worse. So, yeah, we'll see. Oh no, you were saying Dr. Leon. I don't think I took a look at that. Let me make a note of that. Leon Hammer Pulse. I'll take a look at that. Oh, what time is it? Oh, we're okay. I didn't sleep a whole lot last night, so I was like, this is just going to be a short one. So this was an interesting thing that came up on Facebook where someone was asking what happens when a patient comes in and they just say, there's no change, nothing's getting better. How do you approach that? And this is kind of interesting. I think I asked this question when Patrick was on the podcast about what do you do when patients don't get better, and we kind of went on to this discussion about is it something that the patient's doing? Are they not putting in their part of their half of the treatment and things like that? But what do we do when a patient isn't getting better? So I think one thing we should look at, one thing that's important is it's good to take good notes. And so sometimes you'll want to look back at your initial intake and look at the patient where they are now and see if there actually is a change or not. Because sometimes patients, it's like they progress, they're making slow progress, and they don't realize that the changes are there. So sometimes you'll get a patient that will be like, I've been coming for 6 weeks, there really hasn't been any change, I feel exactly the same, and then you go back and flip through your charts and you say, okay, well, right now, today, how's your sleep? And they're like, oh, my sleep's bad, I'm only sleeping 6 hours a night. And you can say, well, when you first came in 4 weeks ago, you were only sleeping 4 hours a night. So there's been some improvement. I say, how's your knee pain? I say, oh, my knee pain's real bad. Every week it's still really bad. Now when I go walk my dog, I can only walk my dog for a mile before my knee gets too achy and I have to stop. Well, you flip back through your charts and you say, well, when you first came in 4 weeks ago, you said you could barely walk around the block. So 4 weeks ago you were walking 1 block, now you're walking 1 mile. It seems like there's been some improvement. So sometimes you really have to you kind of have to go back and look and sort of like remind your patient that where they were and where they are now, and maybe there is some change and they just haven't realized it. So that's one thing I would look at. The other thing to look at is sometimes being honest with the patient about what's involved in getting better. And basically we talk about sometimes the patient has to meet you halfway. And so it's kind of like if I have a patient who complains of anxiety and they're also drinking 4 Monster Energies every day, it's like sticking needles in them once a week is not going to offset the effects of overdosing on caffeine and Monster energies. I mean, this guy, he even said, it's like, it's not the little ones, it's the big ones. And I'm like, I'm pretty sure there's a warning on the can that says, don't drink that much Monster energy. But he was drinking 4 cans of Monster energy a day and having palpitations. And it's like, sorry, you're going to have to, it's like needles and herbs can't counteract that. We need to meet halfway. Is there a way we can cut that down? So that's another thing, is talking to the patient about, are they putting in their half of the treatment. But then sometimes we have to look at, sometimes you do have to be honest about, is the treatment really working? Are you really making a difference? And so sometimes that's a conversation to have with the patient about, is this actually helping? Do you feel like this is helping? Is this getting better? And if it's not, you might need to refer out. And I think, and I feel like I'm okay with this at this point in my career. I'm okay with this. I think that when you're first starting out, people have a lot of ego, or they have this feeling of imposter syndrome. Like when you first start out, they're like, oh, fake it till you make it. Just pretend that you're really good and people will believe you. And some people carry that out through the rest of their careers. And so sometimes people will have that fake it till you make it attitude, and they'll keep trying to convince the patient that they're getting better even when they're not. But I think after a while, the sort of imposter syndrome starts to go away, and you can have more faith in yourself that just because this one person isn't responding, that doesn't mean anything about you as a practitioner. I guess let me give you an example. Before acupuncture, I was doing a lot of massage. And sometimes people would come up to me and they'd be like, oh, you do massage? Are you any good? And I'd say yes. It's something that I had massaged enough people. I've gotten enough feedback that I'm very confident that when somebody says, are you good at massage? I can look them in the eye and say, yes, I am very good at massage. But that doesn't mean that 100% of people that come through my door enjoy their massage. Sometimes there are people that it's just, this isn't for them. What I offer isn't what they're looking for. I work on a lot of athletes. I'm a 200-pound man, and I really dig in and really release the muscles. Some people just want a light, fluffy massage that they just want to be petted, and that's fine. But that means they need to go see somebody else. So just because somebody didn't enjoy my massage, or just because somebody didn't get the results they were looking for, that doesn't mean that I'm a bad massage therapist. That just means they weren't the right fit for me. And I think the same thing can happen in acupuncture, that maybe you're treating a patient and maybe they're not getting the results they want. That doesn't necessarily mean you're a crappy acupuncturist. It just might mean that there's not a good fit there, that you're doing taekwondo and they need jujitsu, so you go send them to a 5-element acupuncturist or something like that. That maybe they just need a different type of treatment. And so sometimes I think that's a good conversation to have, that if your patient isn't getting better, you can sit down with them. And sometimes I've had very honest conversations where I say, look, you've been coming in for 4 weeks. I haven't noticed a lot of change. Do you want to keep going with this treatment plan? Because it seems to me like you might be better off doing something else. And sometimes the patients will be like, no, like even though their pain is a 6 every time they come in, even though their sleep hasn't changed every time that they come in, they say, no, I really enjoy these treatments. I'm getting a lot of benefit out of it. I want to keep coming in every week, that they have other, that they're still getting benefits from it. So you can have that conversation. Sometimes it's a thing where it's like, look, you've been coming in for 4 weeks. We haven't seen much of a change. I don't want to be stealing your money. If this isn't doing anything for you, I don't want to keep taking your money if you're not getting any benefit. Maybe we need to refer out to somebody else who has more specialty in this area, or maybe we need to refer out to somebody else who's a better fit for your constitution or the issue at hand. And I think you don't need to worry about that it's okay to let go of patients, that you'll still have more coming in. Can't remember if there's anything else I wanted to say about that. Sometimes I've seen this happen the other way, where we've had patients that are very ill, or they have a very like a permanent chronic condition, and this is in a student clinic, that they would like have a patient with ALS or something like that, and they say, oh, I feel really bad because each time the patient comes in, they're not getting any better. I feel like I need to adjust my treatment, or I need to do something else. I need to add some herbs. I need to do something because I want them to get better. And I'm just kind of like, at this point with this patient, with this disease, they're not actually going to get better. And now you have to reevaluate your role as a healer. If you think of a healer as, I'm trying to fix this person, they're in a situation where you can't fix them. What you're trying to do is to improve their quality of life. And so that's when you get into like, are you getting benefits from these treatments? And so we had some people that they were coming in because they were terminally ill. Their symptoms were not improving, but we still had them say that this is something I look forward to every week, is being able to come in here and get these treatments, that I get some relief from my symptoms. We're not going to fix the ALS, but we can get some improvement in the quality of life. So that's another thing that happens. Yeah, monsters will kill you. Yeah, I feel like that's just a general caffeine thing. And sometimes it's interesting to see that it's kind of like every body is different. And so especially when I get people coming in with anxiety, that's one of the things we look at, is what's your caffeine intake like? Because some people will drink 4 cups of coffee a day and they're totally fine. They can sleep fine. Everything's good. Some people drink a couple cups of coffee per week. They just have 1 or 2 per week, and they get palpitations, they get anxiety attacks, and they notice this big change. So I think everybody responds a little bit differently, but that's always something to take a look at. I'm trying to parse this out. While mind and body are one, how affects the treatment when the patient sees no progress? And so again, I think maybe we just can evaluate, it's good to have markers to see if there really is progress or not. And sometimes these markers are like a number scale. My pain went from an 8 to a 4, but sometimes they're more about the significance, how it's affecting their activities of daily living. And so sometimes if somebody comes in with knee pain, don't just ask them what is it on a scale of 1 to 10. Ask them, how is it affecting their life? Does it mean they can only walk their dog 1 block before they have to stop? Does it mean it wakes them up 5 times at night, or things like that? Then you can use those. Sometimes are more meaningful gauges of progress. Instead of saying my pain went from an 8 to a 4, you can say, before I could only walk 1 block, now I can walk a mile. Or before I was waking up 5 times during the night, now I'm waking up 2 times during the night. And so sometimes you have to remind the patient that this progress is taking place. But then sometimes you have to have honest talks about these. Sometimes these treatment takes time. Sometimes it's a matter of what they're also putting into it, that I can't fix you just by myself. Sometimes we need you on board as well. And sometimes you just have to say that this isn't for everybody. Maybe we need to refer out. Do I have any more? Oh, this is an interesting email question. Why do the extra points exist? What's going on with the extra points? Why do they exist off the channels? Why are the extra points not on the channels? We have 361 points on the 14 channels, and we have like 40 extra points that are not on the channels. What's up with that? How do we remember them? Because it's like we just have to memorize a bunch of stuff. I actually don't know the history of the extra points, so if somebody more scholarly knows where the extra points came from, I think that would be interesting to see. I don't actually know the history behind them. but basically kind of my interpretation of the extra points is they're basically like empirical points. And so it could be that maybe you talked about this or maybe you didn't, but sometimes in the very beginning of acupuncture channels and points, we talk about different point categories. We have yuan source points, shi clef points, luo connecting points. We have ma dang yang heavenly star points. We have the 8 influential points. Sometimes in that discussion, we talk about a really weird category of points called the empirical points. And what the word empirical means is it's based on experience, not necessarily theoretical knowledge. So when we say something is an empirical point, that means it has this action that we discovered through experience, not because we applied our channel theory. So like when we say stomach 38 is the empirical point for shoulder pain, there's really no theoretical reason why it should work. The stomach channel doesn't go to the shoulder. It's not like the middle of the shin is a mirror image of the shoulder. The channel doesn't go there. There's really no reason why stomach 38 should treat shoulder pain. It's just that people stuck needles there and it worked. So they kept sticking needles and it kept working. And so now we say stomach 38 is the empirical point for shoulder pain. SI4 is the empirical point for jaundice. Lung 7 is the empirical point for headache. And that's like the lung channel doesn't go to the head. Why would that treat headache? And so I think that basically I think of the extra points like empirical points. They're not on the channels because they're not treating the channels. And so with our other points, we can think of the actions of the points based on where the channel pathway goes, what's the functions of the organs it's connected to, and things like that. But the extraordinary points are not on the channels because they don't affect the channel system. They don't affect how the qi flows through the channels. We're kind of just using them to treat certain things. So we have like An Mien is good for sleep. Bai Chong Wu is good for itchy genitals. Luo Zhen is good for neck pain. Yao Tong Shui is good for back pain. It's kind of just somebody needled this point and it's like, oh, my neck feels better. So they kept doing it. There's no channel connection to the neck. They just stuck a needle there and it worked. So they kept doing it. And so that's kind of my interpretation of the extra points, is they're just empirical points that work because people are sticking needles places and they figured out that it worked. So there's not necessarily a whole lot of theory behind them, is what I'm saying. So then, so it's kind of almost like we're treating symptoms. So when we say An Mien is good for sleep, we don't really differentiate. Is that sleep insomnia due to heart blood deficiency? Is it insomnia due to liver blood deficiency? Is it insomnia due to heat in the heart? Is it insomnia due to liver heat, where the hun is not housing itself properly in the liver? We just say, An Mien, it's good for sleep. And then when it comes to remembering them, I think this is one where it's really good to know like the translations of the names. So sometimes when you talk about the points on the 14 channels, I say don't really worry about knowing the names unless it helps you remember the functions or the locations. It's okay to say Li4. We don't necessarily need to know that He Gu means Hidden Valley. But when it comes to the extraordinary points, usually the name of the point it's either related to its location or it's related to its function. And so knowing the translation of the point can be really helpful in some cases. So like the word like An Mien, An means peace, Mien means sleep, An Mien means peaceful sleep or tranquil sleep. And so if a person has sleeping problems, stick a needle in the point called peaceful sleep. And sometimes that's even fun. You can explain it to your patient. If your patient comes in with insomnia, it's like, yeah, do your root treatment, or say, oh, we're going to treat heart blood deficiency, and you can do all your root treatment, do heart 7, do spleen 6, do the regular channel theory stuff. And then you can say, oh, there's this point on your neck that is called An Mien, which in Chinese means peaceful sleep. So we're gonna do this point for peaceful sleep, and the patient will be like, oh yeah, that's totally what I need. And so you can do things like that. We have points like Yao Tong Shui. Yao means lumbar, Tong means pain, like Butong Zitong, Tong Zibutong. Shui means point. So Yao Tong Shui means lumbar pain point. Guess what it treats? Bai Chong Wu means 100 insect burrow. And so it's good for itchiness, especially I usually think of it as like itchiness as in herpes, but I think it might just be itchiness anywhere. But you can think about like 100 insect burrow. It's like you got pubic lice. You got like insects burrowing into your skin and it makes you itchy. That's what you use Bai Chong Wu for. So I guess that's how I would remember it. Instead of trying to make some connection between like channel theory or things like that, you can make a connection between the name of the point and either its location or what it does. Awesome, James Bond. What classics do you recommend to read for a student who just started studying? I would generally say if you just started, don't read the classics. And I guess we should clarify here, because sometimes you will get confused about what we mean when we say the classics. When I say like the Machiocha textbook, that is not a classic. When I say the Wang Juyi Applied Channel Theory, that's a modern book. It's not a classic. When we say classic, we mean books that were written thousands of years ago. We could say our main classics are the Huangdi Neijing, the Yellow Emperor's Inner Canon, the Nanjing, the Classic of Difficulties, and some people will include the Shanghan Lun, because that's a very old one. And if we wanted a number 4, the Shenrong Ben Cao Jing, we could say those are the 4 major classics. But then we have other books like the Pi Wei Lun, the Treatise on the Spleen and Stomach, or Prescriptions Worth 1,000 Ducats of Gold, or things by Ye Tianshi and Li Shizhen and things like that. We could all the Mai Jing, the Pulse Classic. These are all classics. They're things that were written thousands of years ago. I wouldn't necessarily start there, because it's weird, it's confusing, it's hard to understand, especially if you don't have any context, or especially if you don't have any background, especially if you don't have anybody explaining what is meant by some of these things. It can just be really confusing. So I wouldn't necessarily start there. I think if you were just starting, I would read more general books like The Web That Has No Weaver by Ted Kapchuk is a really good, I think, introduction. If you're like a year into it, I like Wang Juyi's Applied Channel Theory. Gives a lot of good overview about channel theory, how channel theory differs from organ theory, and how to palpate the channels. And it gives a good overview of the secondary channels, like the Lowell connecting channels, the 8 extraordinary channels, and gives good explanations of the point categories. So if you want to read that book, if you're starting out or a year into school, I think that would be a good book to read. But in terms of reading the classics, sometimes I think it's more like the approach I like to take is we can talk about certain topics and then kind of sprinkle in excerpts from the classics. So when we talk about the 8 extraordinary meridians, I'll say, oh yeah, there's this passage from chapter 28 of the Nanjing where the Nanjing says, the 8 extraordinary channels, why are they extraordinary? What does this mean? It is like this. The 8 extraordinary channels are outside of the flow of the 12 normal meridians. So in the normal cyclical flow of lung, large intestine, stomach, spleen, heart, SIUB, kidney, pericardium, sandra, gallbladder, liver, the 8 extraordinary channels are not part of that flow. And that's why we call them extraordinary. They're not touched by the 12 channels. And we say, oh, it's like it's like the sages of the past. If there was a great rain that came down from the mountains, that would flood the field. So what the sages of the past did is they built great reservoirs so that if the irrigation ditches overflowed, the reservoirs were there to accept the surplus. And that's what when we say the 8 extraordinary channels are reservoirs of qi and blood, that's what we mean. And so we can kind of pull that excerpt from the Nanjing, but honestly, if you haven't studied Chinese medicine and you just sit down and tried to read the Nanjing, I don't think it would make very much sense. So I wouldn't necessarily start there. I would say maybe if you're a couple years into it, then maybe go into it. But maybe when you're starting out, like if you're reading Machiocha, he'll have some excerpts from the classics. Or if you're even reading the Nigel Weissman book, he'll have some excerpts from the classics. And you can kind of pay attention to those. But just straight up reading the classics is kind of annoying. Oh, Tara. Hi, Tara. From Fort Lauderdale. Class loves your video. Glad you like the videos. I need to make more of them. So we'll keep slowly making more videos, slowly plodding along. So I'm glad that people like them. It's kind of weird when people like, because I started out making videos just that I was teaching a class and I just kind of made them as review for my class, and then like now later I'm getting people like, oh yeah, I'm from Iceland and my teacher showed your video in class. Like, oh, that's cool. So I'm glad people like them. What made you move to Colorado? I was in San Diego. I was in San Diego. Basically, I got tired of San Diego. California is kind of weird. I think California is not a good long-term place to live. I feel like living in California is not real life. Living in Southern California is like living in the dorms at college. It's not real life. But basically, I was in California. Basically, I moved back to San Diego to teach at a school in San Diego. That was okay. I never wanted to stay there forever. Once COVID happened, the school said they were switching to online, and I was like, I don't want to teach online. If I want to teach online, I can make YouTube videos and reach thousands of people online. If I teach at an online school, then it's like I'm getting paid $25 an hour to teach 10 students at a time. That's not very much money. It's not very much impact. I would rather just reach people through my YouTube videos and do that. So I was like, I don't want to teach Zoom classes in school. I'm just going to make my own videos. It's like, if I'm just making my own videos, I don't need to be living in Southern California to do that. So San Diego is really expensive. So part of it was I wanted to move someplace cheaper. Part was I got tired of San Diego. I don't really like going to the beach. I like hiking way better than I like going to the beach. You know, the sand, it's coarse, it's rough, it's irritating, it gets everywhere. I don't understand why people are so into the beach. Also, where I was living was really loud. I lived right next to an emergency, an ER, so I always had sirens going by. So I moved out to the middle of nowhere. It's real quiet out here. Yeah, I just move around a lot. I'm Sagittarius, so I move around a lot. So yeah, Tara's saying we're learning the channels and the videos are helpful. That's great. I'm glad people like those videos. They take it. It's kind of one of those things where like whenever I make a video, people are like, "When are you going to make the gallbladder channel? When are you going to make the liver channel or the UB channel?" I've been really avoiding the UB channel because it's just really long and annoying. But I'm glad people are liking the channel videos. We'll keep making them, but it just takes a while. Let's see if there's anything else. If anybody else has any questions. Otherwise, I might just go take a nap. So if anybody has any other questions, let me know. Oh yeah, we're past an hour. Oh yeah, we've been going for a while. Doesn't look like there's a whole lot else. Back saying thank you. I appreciate that. I'm glad people enjoy it. Sometimes it gets. YouTube is a weird thing. Sometimes it's one of those things where it's like you can have 100 people leave you nice comments. As soon as that one person leaves a mean comment telling you your shirt's ugly, that's the only one you remember. So I'm glad people appreciate it. So we'll keep making videos. Some of them might be. I might pause on some of the videos for a little bit. I was thinking I was going to try to make like a quick UB channel one. I'm not sure if I'm actually going to get to that. So what's coming up in the future is, one, I did want to make a series of videos that were just short 3 to 5 minute videos that were Q&A videos, like what's the difference between fear and fright, what is meant by inverted menses, stuff about bleeding, just like short 3-minute videos. those would be fun. So I may or may not actually get around to that. But actually what I've started doing, this is why I was up late last night because I got into this. I want to start doing some formula review stuff. And so just like I have a single herbs review course, I want to get started on a formula review course. And what I'm thinking is in the next couple weeks, we'll start doing that, and it'll be like we'll just start out as like a live webinar, and that'll be like the rough draft, as we can just go through all the formulas that are on the NCCOM list and do a review of formulas, and then we'll go through and I'll kind of clean it up. I'll re-record it and clean it up, and that will be like a formulas course. And so sometimes that stuff takes a while, so that's what I've been working on now is getting all those formulas organized and making some handouts and doing some stuff that we can just go over all the formulas, because that's something that a lot of people have been asking about, and I think that would be really helpful especially if you're taking boards or nationals. We can start going over some formulas. So that's what's going to come up in the next couple weeks. I have to look at the calendar for that. I think it's not going to be a week from now. It might be 2 weeks from now that's going to start. And we'll just do live webinars where you go through the first third of the formulas, then the second third of the formulas, then the third third of the formulas, and do it 1 week at a time. So that's what we might be doing coming up. That's the plan. Again, thank you for the Patreon people for your support. We appreciate that. I have some more people booked for the podcast. So if you go to podcast.tcmstudy.net, I think I finally have a few people lined up for that. We took a couple weeks off just because I was having trouble getting some people on board for that. But I think we have some more people on that. So we'll have more podcasts coming up. I think that's it. So thank you for being here. Thank you for spending a Friday with me. I think we will do it next Friday. So I think we might do one more next Friday, and then we might switch over to doing herb review. So maybe we'll do another just Q&A next Friday, and then we'll be switching over into review of herbal formulas. So thank you for being here. Thanks for hanging out. We'll see you next time. Oh, and if I didn't get to your questions, or if you're watching on the replay, if you have questions, leave them in the comments below, and we'll get to them next time. So I'll check the comments, and so if you have some questions, leave them in the comments, and we'll answer them on the next live stream. Yes, make sure to wash your hands. Even if you've gotten vaccinated, you should still wash your hands.